So these are three examples of multidentate ligands. As you know, we said that coordination number is a property of the substrate. The concept of multidentate or being a multidentate is a property of the ligand. Here we have a bidentate ligand. Again, a bidentate ligand. This is the ligand here, and this is the ligand here. It has two binding sites with the metal again here. But here, this one is again a multidentate ligand. This is EDTA, or ethylene diamine tetraacetic acid. So it has 6 binding sites that can bind or make bonds with the central metal, which is the substrate. This EDTA compound is really important in many applications, in pharmaceutical applications, industrial, like toxicological, in many applications that we will talk about in a minute. So, coordination number is a property of the substrate. Being multidentate is a property of the ligand. Good. Before we talk about EDTA in a little bit of more detail, this is a live example of a metal ion complex. Here we have Fe, or iron, which is the substrate, and 4 units of heme that will make metal complexes with the Fe to form a complex. Just a live example for you to know about. Now, let's return to the this compound, which was EDTA. EDTA is the ligand, a large molecule that has 6 binding sites that can form a complex with metals. Usually, a complex like this is called a chelate. A chelate is a complex that is being formed between a metal ion and a multidentate ligand. What is a multidentate ligand? It's a ligand that has more than one binding site to form a complex with a metal. Now, this is really important. Let me give you an example. You know those workers that work at like oil stations? And I'm sure all of you have heard of lead toxicity. Lead, let me just demonstrate this. People at oil stations are more susceptible for, by the way, this is a handle of oil, I think. I'm not sure if it is the right structure design or not. So, usually, especially in a country like Iraq, there's a lot of lead in the oil or in the fuel that is being used in cars. This lead usually causes toxicity to the workers that work at these stations because they are exposed to a lot of lead in the vapors of the fuel that is available in the station. These guys sometimes get acute toxicity of this lead by certain like mechanisms or like certain events that can happen at those stations. Lead poisoning is a serious problem. So EDTA has been used to as a treatment for lead poisoning or any other metal poisoning. Let's say there's a child that drinks, or let's say exposed to heavy metal poisoning. We can use, or we can employ multidentate ligands like EDTA to make complexes with the metal in the body of that person that has been intoxicated by this metal. And let's read this. In the management of poisoning with heavy metals, a ligand such as EDTA can surround and bind in many sites with the metal ion and deactivate or excrete the metal. So this is a way in which we can employ the concept or the phenomenon of chelation, which, as we said, is the are the complexes that are formed between a multidentate ligand and a metal. Good. We are finished with metal ion complexes. Let's talk about the second category, which are the organic molecular complexes. Organic molecular complexes are formed as a result of non-covalent interactions between a ligand and a substrate. So this interaction between ligand and substrate does not have to be like covalent always. It can happen by organic bonds or organic interactions. And these organic interactions can be van der Waals forces, charge transfer bonds, hydrogen bonding, and hydrophobic interactions between the ligand and the substrate. By the way, we always say ligand and substrate. In these kind of interactions, this concept of ligand and substrate will a little bit like fade away, because this was a common term, this donor-acceptor mechanism of complexation, which was previously exclusively used for metal complexes that we talked about before. Now, in organic compounds, complexation can happen as well. Here we have two molecules that have formed another, these two have reacted to form this product. This is a whole new product. But here, the same two molecules have formed a complex. This one has happened in cold conditions. This one is warmer conditions, or at higher temperature conditions. So usually complexes that are organic can be kind of easily separated from each other, while a normal reaction, which is not a complex, like this example that has happened at higher temperatures, it's more difficult to separate these two together. Now, let's give an example of an organic molecule complex. Caffeine. I'm sure all of you have heard of this molecule. Caffeine can form complexes with many drugs. This is an example of interactions that will happen between caffeine and different drugs. Hydrogen bonding can be formed between the polarizable carbonyl group of caffeine and hydrogen atom of the acidic drugs, or dipole-dipole interaction, which we have talked about in first semester, between the electrophilic nitrogen of caffeine and carboxy oxygen of esters like benzocaine and procaine. And this concept of complex formation of caffeine with many drugs is the reason behind the fact that we ask many patients to not take caffeine or not take like tea and coffee and things that contain like high concentrations of caffeine with their drugs, because caffeine can form complex with many type of drugs. Now, let's read this paragraph. Caffeine forms water-soluble complexes more than caffeine itself with organic acid and ions. But complexes formed with organic acids such as gentisic acid are less soluble than caffeine alone. Such insoluble complexes provide caffeine in a form that masks its normally bitter taste in chewable tablets. Let me tell you something. Caffeine is really bitter. You will not like to take caffeine like itself. So let's say we have extracted caffeine from coffee or anything else. Caffeine by itself is very bitter. So how we can have a tablet which is caffeine? I am sure all of you have had like caffeine tablets. I think it's available in stores. It's like, I think it's in a metal box. I'm not sure. But why these caffeine tablets are not bitter? We said that caffeine is really bitter. So how these tablets are not bitter and you can chew them and you can like enjoy them? How? Because they have made insoluble complexes of caffeine with something that makes the resulting complex less soluble than caffeine itself. And if something is not soluble in water, you will not feel the taste. And I think I have told you this before. We only taste water-soluble stuff. Our tongue does not feel water-insoluble like things. So if something is not water-soluble, you will not feel the taste. So if you make like caffeine, it is water-soluble by itself, so you can feel the bitter taste. But if you make a water-insoluble complex of caffeine, you will mask the bitter taste, and then when the caffeine reaches its target site, it can separate from the complexing agent, and it will be available as you intended. Now, polymer complexes. In many pharmaceutical applications, we use polymers. Examples are eudragite, chitosan, polyethylene glycols, polyphenol like pyrrolidone, sodium carboxymethylcellulose, and many other polymers that we use in to like make final formulations. And I'm sure you know the role of many of these different polymers. I think we've talked about them before. We use them as fillers, as binders, as lubricants, as like many applications or many techniques that we use them. These polymers that we use in different formulations, we have to consider whether they can form complexes with the active pharmaceutical ingredient or the API in the final formulation. Because certain complexation reactions can happen between the polymers and the drug that can result in many unwanted like things like precipitation, flocculation, solubilization, or the opposite of solubilization, and like alteration of the whole effect of the drug. So this slide is all about the fact that we have to consider and we have to predict the chance that these polymers that we use in pharmaceutical formulations, we have to make sure to know what are the chances of complexes to be formed between the polymer and the active pharmaceutical ingredients. And here is an example. You can now, drug protein binding, another type of organic molecular complexes. You know that our blood contains many proteins, and albumin is the most important or most abundant protein in our blood. And I'm sure you know that when we take drugs, or a drug is being administered, or when a drug is bioavailable, or when it reaches blood, some of the drug is usually protein bound. This bond between the drug and proteins in the blood is a complexation reaction. And because albumin is the most abundant or the most important, let's say, protein in blood, and of course because of its high concentration relative to other proteins, usually we say that the drug is albumin bound because it's available in blood in really high concentrations. So this complex formation between the drugs and blood proteins can influence or affect the action of the drug in many ways. Like, it can affect distribution of the drug. For example, the drug may not be able to pass certain membranes if it is protein bound because of the size of the complex. It can inactivate the effect of the drug, because usually the drug that is protein bound is not effective. The drug should be free to be effective because we intend the drug to be like itself. And if a drug is bound to something or have made a complex with something, it will not be effective. So the more the drug is protein bound, the less of the drug will be available, or free drug will be available for effect or to have any effect. Another mechanism that protein binding can affect the role of drugs is by affecting the drug excretion, because a drug may not be able to pass through membranes in kidney to be excreted. The drug has to be free to be excreted, and vice versa. And there are certain ways that protein binding can affect the role or action of drugs in our bodies. Again, because protein binding of drugs is such an important thing to know about, we have to understand K again. We have to remind you of this thing. K was complex stability constant. If a drug has high K or complex stability constant, that means the stability of the complex that is being formed between the drug and the blood proteins is high. That means we have less tendency of the free drug to be formed and more tendency of the protein bound complex to be formed. Okay, let's read this line. Why drug protein complex stability constant is very important to know about. Well, it is really important to know about, because, for example, if this is just an example, for example, let's say we have 10 milligram of a drug that is available in our blood. If K of this drug, or stability constant of the complex that this drug forms with blood proteins, is very high, means very little of the drug is available as free drug. Okay, so we need to increase the dose of this drug to make more drug available freely to be effective. So it's really important to know how much of the drug, or the like ratio of the drug that is protein bound, to know or to predict the dosage that we have to use to reach a certain free drug concentration in blood to be effective. Now, an example of a drug that is extensively protein bound is warfarin, which means its Ks value is very high, because higher Ks means higher complex stability. And so warfarin has a very high Ks, or Kf, or just K. So administration of another drug that has high affinity for plasma protein, like non-steroidal anti-inflammatory drugs, many of them, will displace warfarin from its binding site and causes serious hemorrhage. So this can be a question in the exam. I can ask you, like, why it's really important to know about the protein binding of drugs, like combination of drugs that we use. Because a drug like warfarin is really sensitive, and the high doses of warfarin in blood can cause hemorrhage. And warfarin by itself is very, it's very protein bound. So if we take another drug which has more affinity for proteins, it will compete with warfarin for the binding sites of the protein in blood, and it will displace warfarin from this complex, or this protein binding, and it will increase free warfarin, and it will increase the chance of hemorrhage. Okay. So another factor to consider when you take a drug like warfarin, which is highly protein bound, is age. Because if you read this line, it says some diseases decrease available protein in blood, like age and malnutrition and trauma. So if you have a drug like warfarin, which is really sensitive by itself, and it's very highly protein bound, and you suddenly decrease the protein in blood, that will increase the warfarin which is free, okay? And again, it will increase the chance of toxicity and hemorrhage. So I hope you have understood this concept, and if you had any questions, you can ask. Now, the last type of complexes that we will talk about in this lecture are inclusion complexes. An inclusion complex, or an inclusion compound, is a complex in which one chemical compound, the host, forms a cavity in which molecule of a second compound or a guest is entrapped. So as we said, complexes are categorized into three categories: metal complexes, organic complexes, and inclusion complexes. Here, the concept of donor-acceptor was really obvious. In organic complexes, it was a little bit vague. In inclusion complexes, the concept of donor-acceptor is a little bit more vague and unclear, because here the concept, like the idea, changed a little bit to a host-guest relationship. And these are examples of inclusion complexes. In all of them, the concept is very simple. It's like this. You have something, okay, and you have another thing that will be entrapped here. That's it. This is an inclusion complex. We have a complex between this and this to form this. This is an inclusion complex. So let's give an example of this. It says most common of inclusion complexes are monomolecular cyclodextrins. This term, cyclodextrins, you will definitely hear this term again and again after you graduate, especially if you choose pharmaceutical or pharmaceutical sciences, like in your postgraduate studies. This is a cyclodextrin. This structure. It has a hydrophilic outer layer and a hydrophobic inner layer. So if you have a drug like this drug is not water soluble, or it's water insoluble. So we cannot dissolve this in water. So how we can prepare a formulation of this drug? We have many methods. One of the methods that we can employ is cyclodextrins, or is inclusion complexes. We can have a structure like this. Let me just erase this because I think sorry. Okay, this is an inclusion complex. We can put this drug in this cavity because this drug is hydrophobic and this cavity is hydrophobic, but the outer layer of this structure is hydrophilic. So we can incorporate this drug into aqueous media very easily. So it's like we have solubilized this hydrophobic drug by employing inclusion complexes. And then when the drug reaches its target site, it can just get out of this cavity and it can have its effect. Now, this is like a picture of the drug within the cavity of the cyclodextrin, which is an inclusion complex, and this is the drug outside the structure. Now, let's read this paragraph. In addition to improving the solubility of the compound, complexation with cyclodextrins has been used to improve stability of many drugs by inclusion of the compound and protecting certain functional groups from degradation. So these inclusion complexes are not only used for solubilization of drugs, it can be used to improve stability, because this drug may be susceptible to many environmental factors. If you entrap it here in this cavity, it can be protected from degradation, like from many factors, and whenever it is needed or at target sites or whatever, it can be relocated and displaced, and it can do whatever job it has been intended to do. So if you have any questions, you can ask by commenting on this video, or I think we didn't have any room for interaction with you or any interactivity, because I usually like to ask you questions and stuff like that. I hope that you have understood the concept of complexation. It was a little bit maybe of a complex subject to have. If you had any questions, you can ask and you will have your answer.